Thank you, everybody, and welcome back to the Oregon, Washington, Alaska virtual conference, our third session. This session is sponsored by the Haas Group. The Haas Group of companies include Professional Credit, KG Haas, and InSource, all dedicated to improving patient financial engagement. Professional Credit, founded in 1933, is an HFMA peer review collection agency delivering superior recovery through its patient-friendly omni-channel engagement platform. KG Haas provides technology solutions such as speech analytics to optimize the patient experience, and InSource is a digital-first self-pay early health service. Each entity proudly shares a common culture of integrity, innovation, and continuous improvement. So thank you, Haas, for your ongoing support in the Oregon chapter. So this session is managing through the COVID-19 recovery and rolling forecasting. And our guest speaker is Angela Esty. She's with Centellus Performance Solutions, formerly known as Kaufman Hall. Healthcare professionals are increasingly turning to rolling forecasting to fortify their organization's financial projections with the most current performance information and data-driven insights. Rolling forecasting is commonly used as a complement, or in some cases, a replacement to the existing annual budgeting process. This presentation is going to discuss how rolling forecasting works, considerations as you transition to this approach, and lessons learned from several clients experiencing adopting rolling forecasting to meet budgetary challenges. You'll learn how rolling forecasting can improve timely allocations of resources, focus on forward-looking view of organization performance, and provide visibility to guide strategic planning and execution. Welcome, Angela.
Thank you. Can you hear me okay?
We can hear you.
All right. Shall I share my screen?
Yes.
All right. Tell me if you can see it okay.
Yes.
Great.
Good to go.
Thank you very much. Welcome, everyone. I'm here today to talk to you about managing through the COVID-19 recovery with rolling forecasting. When I was originally asked to speak on the topic of rolling forecast, it was pre-COVID. So when the conference was deferred, obviously a lot has changed since then, and I thought it would be more interesting to many of you to talk about the experiences I've had with our client base at Centellus Performance Solutions, formerly Kaufman Hall and Associates, and help you understand how our client base is utilizing the rolling forecast tool and how we're helping consult them through the processes. Just to give you a little bit of background on my experience, I have been with Kaufman Hall, now Centellus Performance Solutions, since 2013. I started as an implementation consultant. I then moved into the rolling forecast product owner position when the product moved into the Axiom platform. From there, I moved into a healthcare practice lead role where I oversee the consultants that implement the rolling forecast and budgeting, productivity, provider, comparative analytics solutions. So before I get into the agenda today, I thought I would talk just a little bit about my role and why I'm speaking about the rolling forecast process. Because of my experience implementing the product and as a product owner, when COVID-19 hit our country, we immediately had a great request from not only our client base, but also healthcare clients across the country to help them figure out how they're going to start planning with the new pandemic that hit them. And so I've spent the last 4 months of my time at Kaufman Hall, now Centellus, meeting with CFOs across the country, demoing the software, answering questions, and really helping them make decisions about what they're going to do to get through this recovery. So it's that experience that I'm going to talk to you about today, and I suspect a lot of the stories I'm going to tell you might seem very familiar to you, and I look forward to your questions and feedback at the end of this presentation. So let's move on. Our agenda for this presentation, we went through introductions. We're going to start talking first about operating as healthcare providers in these uncertain times. We're then going to transition to talking about staying agile in a dynamic industry, and then making rolling forecasts work in your organization. From there, we'll talk a little bit more about how to utilize forecasting through the COVID-19 time frame, and then if we have enough time, we're going to talk more about how to utilize rolling forecasting reporting to help understand the metrics and where your organization is trending. So we're going to start first with talking about your current planning challenges. Prior to COVID-19, healthcare organizations were already challenged with managing in uncertain times. Declining in patient volumes and revenues and shifting payer mix, increase in competition from new players entering the market were all factors that were affecting healthcare. And these market forces required health organizations like yours to reposition yourselves to define your competitive edge in order to sustain your financial health. Competition, whether local or national, forced health systems to determine not only who they are, but what they offer. And it required the agility to shift their focus with the trending times. The new normal for finance departments is to manage expectations and the pressures of the constant changing market. Finding better ways to track your cost reductions through initiatives and handling the financial impact of mergers and acquisitions, understanding how to invest your capital, and allowing you the ability to manage your bottom line pressures became challenging to manage with the traditional budget process. And then came COVID-19. The disruption introduced to your organizations presented planning challenges finance organizations had never seen before. It required you to react quickly, in many cases on a daily basis, twice a day, and some of my clients, constantly reforecasting not only the impact to your bottom line, but also the more immediate risk to your balance sheet. My story today is to tell you how we at Syntellis Performance Solutions were able to help our clients navigate through these past 4 months utilizing a software called rolling forecasting to effectively manage through the COVID-19 recovery. The loss in volumes for many organizations with low COVID cases due to the canceled elective surgeries and physician office visits devastated many health systems' financials. While the margins in April and May started to show improvements, we were seeing significantly lower levels compared to the 2019 AM budget. May's median hospital operating margins were pushed up to 4% with more than $50 billion in CARES Act funding that was provided, but without this funding, the median margin would still have been at a negative 8%. So the challenge that we faced as a software and consulting company supporting healthcare clients during COVID-19 was that depending on the location of where our clients resided, there were different scenario options to consider. Every client required a unique recovery approach, but what they all had in common, however, is that no matter where they were in the country, their detailed budget planning process that they relied on previously to manage their business no longer served as a tool to help them understand their future. The drastic impact of COVID made it clear that budgets were obsolete, requiring many organizations to look to a more flexible methodology called rolling forecasting. As soon as the pandemic hit, Syntellis' 630 fiscal year-end clients let us know that they were walking away from their annual budget process, or they had no plans to even start it. Our 930 and 1231 fiscal year-end clients said they had no intention to do a budget next year because the COVID quarter, that's what we're calling March through June, the COVID quarter in their baseline data was going to completely skew their trends. As we began to meet with our clients on how to address their current dilemma with budgeting and whether or not they should move to a rolling forecast process, we outlined their needs from a strategic perspective, utilizing a now, near, and far approach. For now, in the immediate time frame, the goal was to find a way to monitor performance and capture feedback so they could be nimble enough to shift gears quickly. We recommended an immediate move to measure themselves at a cost and revenue per unit KPI, or key performance indicator, so at a minimum, they could ensure they were maintaining their historical run rates. For the near, we worked to get as many clients as we could up on the rolling forecast product as quickly as possible. To do this, we had to find a way to creatively shorten the implementation process and timeline so that it could be up and running within 4 to 6 weeks. And we did this creatively with utilizing our comparative analytics machine learning to help us remove the roadblocks from some of the key decision points that typically happen during a rolling forecast engagement around forecast structure. We knew rolling forecasts would allow our clients to stay agile and manage resources in the near term to support their far long-term strategies. Keeping an eye on the long-range financial plan was still critical to ensure that they had the right strategic approach, supported with more frequent forecasted data. We enabled our clients to effectively navigate their way through the remainder of 2020 using a prepare, respond, and recover approach. The goal was to empower our clients to analyze the impact of COVID in their organization, simulate the possible recovery patterns, monitor their initiatives put in place to contain costs, and measure the long-term impact on revenue losses. What was also critical in supporting our clients through the late spring and early summer was to bring our client base together on a monthly basis to connect on a rolling forecast roundtable, where we provided current topics on how they could creatively utilize the software to manage the complexities of their current business challenges. Attendance to these webinars was high, and many of them found that hearing a lot of value, hearing the stories that they heard from around the country, and many were paying very close attention to those clients that were experiencing the financial impacts early on versus those with a slower surge rates in their areas. Let's talk a little bit about staying agile in this dynamic industry. With so much uncertainty, now more than ever, agile planning was imperative for healthcare organizations across the country. A rolling forecast process integrates seamlessly into the larger integrated decision-making process, which includes strategic planning, financial planning, budgeting and forecasting, capital allocation, capital budgeting, and outcome measurements. The process begins with understanding your strategic goals, which are defined from your long-range financial plan, and that's driving the long-term balances of sources and uses of capital. Understanding your debt capacity allows you to identify the capital structure that can be put in place to understand how much you can spend and where you can deploy your funds in order to make sure that you're getting the greatest return from your investment. Allocating those funds to see the operational impact of the capital projects and then monitoring it through budgeting was the path many of our clients were accustomed to. Adding rolling forecasts to this process allows for continuous monitoring and course correcting as the effects of COVID-19 and other market factors cascaded through your organization. And so the cycle continues. Before the pandemic, when we talked to our clients about how to manage their financial gap, which was typically EBITDA, from their actual trajectory of their long-range financial plan targets, we discussed the need to have agility to adjust on a quarterly basis utilizing corporate initiatives. COVID-19 introduced a kind of uncertainty that our clients never experienced before. Liquidity became the focal point as cash constraints were increasing. We saw clients for the first time open lines of credit to avoid taking losses from tapping into investment funds already at record lows to support their cash requirements. Hospitals were looking to extend payment terms on their bills, and PPE supply costs were increasing due to the demand and shortages. They also noted slower claims processing and reduced point of service collections. Capacity was also another challenge we saw our finance teams face during March to June. With furloughs taking place and resources redirected, organizations didn't have the capacity to lean on the business leaders to help them provide insight for their financial position and contribute to a reforecast. We noticed that many of our budget clients that did not already have a rolling forecast model in place defaulted to using Excel to model their reforecast at an entity level to provide insight to what was to come in the near term. Kaufman Hall every year prepares a CFO Outlook survey, where they survey CFOs throughout the country. And with the 2019 CFO Outlook survey, we noted that 44% of healthcare organizations today utilize a rolling forecast product module of some type. And out of that 44%, 88% are using rolling forecasts as a complement to the budget process, where the other 12% are using it as a replacement to the budget. Within our own client base, currently that number is over 30% using rolling forecasting now as a replacement to the budgeting process, and we're seeing that number rise very quickly. Many of our budgeting clients were abandoning their budget planning process at the onset of the pandemic. The main reason was the process was too resource intensive. Our 6/30 fiscal year-end clients also found that pre-COVID assumptions were already locked in by the time the pandemic hit, and all their work became immediately obsolete. In addition, the historical trends from prior year were not meaningful to project future seasonality. Budgets were being too rigid, limiting finance's ability to course correct as the market conditions changed. And finally, with budget variance reporting, because it is retrospective, no longer helped to explain what systems needed to focus on in the near term. So let's talk a little bit about how we can make rolling forecasts work in your organization and some of those key considerations. When I meet with potential clients, when they're looking at a rolling forecast process, there's really two basic questions that you need to ask yourself and your organization. It's critical to deciding how the rolling forecast process is going to work within your organization. That first question is thinking through what's the role that rolling forecast is going to play. Will it replace your operational budget, or will it be designed to complement your budget process? Typically, when we see that clients are doing it at a higher entity level, the ones that are replacing their operational budget are using more of a functional area structure, and we'll talk a little bit about that in more detail. The second question, once they've answered the first, is to really consider what impact is it going to have on their performance reporting. If you're replacing the budget, what are the guardrails going to be that you're going to want to set now without a budget to be held as a variance to? What KPI metrics are you going to utilize? Really understanding that that is one of the key decisions you really have to understand. It's going to change how your reporting is going to look. And if you're complementing the budget process, so you've got two plans in play now, which plan wins? Additional considerations are around how you're going to educate the organization and really establish buy-in from the organization. More critical to clients that are replacing budget with rolling forecast, it's key to not just be ready to replace your budget, but you also need to be prepared. There really is a difference. So many clients will come to us and say, we're ready, we want to get rid of budget, we're tired of it, it takes us 6 to 8 months to do our budgets, and then they're obsolete by the time we get into our fiscal year. But it really takes a state of preparedness. Have you done your homework? Do you know how your reports are going to change? Have you educated your organization on a per unit basis, because that's the language they're going to start speaking. So making sure that first and foremost, you've got executive buy-in, because if the top layer of your organization doesn't believe in a rolling forecast process, the forecast will not succeed. And then once you've determined that, yes, this is definitely where our organization is headed, making sure that you educate your organization is key. So to understand better how rolling forecast fits within the whole financial plan, you can see here we've got really the 3 columns of the different types of plans within an organization, starting on the right with an annual budget, and then to the left, the long-range financial plan. So rolling forecast really is that in-between planning process, especially if you are keeping rolling forecast as a complement to your budget process. And then as you go vertically downward from this slide, we're going to start first with what the planning frequency and time horizon is. Are you going to be forecasting quarterly or on a monthly basis? When you look at your annual budget process, you're doing it just that. You're doing it annually for the next year. From a financial plan perspective, you might be working on the plan once every 2 to 3 years. Rolling forecast has the option to forecast every month or every quarter. In our client base, I would say 95% of our clients are forecasting on a quarterly basis, and most forecast out to the end of their next fiscal year, but they can forecast out 3 years if they want. The time cycle to complete the process is, how much time are you going to be using resources to prepare that forecast? From a budget perspective, typically it's 3 to 6 months, but from our last survey, our last CFO survey, we noted that it's actually greater than 6 months. So a real strain on your resources for budgeting. From a financial planning process, typically a 1 to 2 month time frame. For our rolling forecast clients that are in a regular quarterly sequence, it typically takes them 2 to 3 weeks to do their forecast, and that's really from starting in finance, reviewing their metrics, building out plan files, and then sending them out to the end users in the organization, typically not in the hands of the end users for more than 5 or 6 business days, and then back into finance to prepare for reporting. The next area of difference is really around how are you planning, at what level are you planning this process. And from an annual budget perspective, we do it down to a department level. For a financial plan, it's typically planned out at an entity level or a facility level. And rolling forecast can be somewhere in between. We either see a functional area design where you'll see forecasts for areas like surgery, imaging, nursing, ED, or we see organizations, much larger organizations, national organizations that keep their budgeting process also with their rolling forecast, doing it at an entity level structure. And that's where you would see per entity maybe 3 workbooks where they're forecasting for the hospital, the clinics, and other administrative. Level of detail is also an area where you need to understand what the differences are between budget, rolling forecast, and plan. From an annual budget perspective, you're typically budgeting at an account level from your general ledger. From the financial plan, it's your financial statement categories, but rolling forecast has the option to be somewhere in between. You don't want to be forecasting down at an account level because you want to maintain being nimble, but you also don't want to just be tied to the financial statement category. So we have forecast groupings that we typically provide our clients with a starter kit to get them up and running, where there's a little more detail around areas like salaries, benefits, contractual allowances broken out by payer, areas like that. And finally, variance reporting. There's a definite difference there. So for an annual budget, you're going to be focusing on your dollar and percentage variances compared to a plan where really you're looking at how are you trending from your financial planning targets and ratios. Within rolling forecast, industry-wide, the rolling forecast variance analysis is around your KPI targets, your revenues and costs per units, and how are you trending compared to either benchmarks that you've set for yourself or past performance. So a little more detail around design considerations once you are moving into a rolling forecast structure. First and foremost is the forecast group, and this is one of those decision points that our clients really would get stuck on. It would take them a number of weeks to really come to a decision on how they wanted to be structured. So when COVID-19 hit and we needed to get clients up very quickly, we couldn't wait for these decision points to be made and have that leadership buy-in across the organization stall the build. So we utilized the comparative analytics to really help get these decision points decided more quickly, with having the machine learning identify functional areas very quickly and the key statistics that are going to be used with those functional areas to help them get a structure in place. Some of our clients just wanted to take it at an entity level. They were keeping their budget and they just wanted to forecast very quickly at entity level, so that's also an option. So really those are the 2 areas where we see the distinction in a forecast structure. Forecast codes are really those account groupings and at a little bit more detail than your financial statement categories, but not too detailed at an account level. So you can see here how we've broken out benefits to either a rate per FTE or a percent of salary structure. You'd break out supplies like medical supplies, drugs, or office. Some people would break out implants, any volume-driven type of supplies that you'd want to have variability. And then some of our clients really wanted to break out their salary components to a lot more level of detail. If their GL structure was more what we call a pay code, pay type level of detail, where all they see is regular pay, overtime, non-prod, and maybe they wanted to have their payroll broken out by job code level, we'd utilize their payroll data tables to then forecast out their salaries by job class. So I've worked with pretty much all of our clients over the last 7 years on rolling forecasts in one way or another, whether or not I've been the implementation consultant, the project sponsor, or just a subject matter expert to help them consult them through their forecast process. Here you see 3 of our rolling forecast clients. Common Spirit, formerly known as Catholic Health Initiatives, was one of our first rolling forecast clients on the Axiom platform. However, when we were on the Enough Suite, we've actually been doing rolling forecasts for, I think, 18 years. So Common Spirit joined us, and they decided to maintain their budget process. So they wanted to do a rolling forecast at an entity level structure. So you can see here it's a pure entity level structure where for each entity and for them it's their different locations or regions that they call MBOs. They break out their groups by hospital per region, clinics, and other. Scripps out in San Diego, California, they also replaced their budget process with the rolling forecast, and they utilize more of a functional area design across their acute care business. So in this structure, you can see group structures like surgery, nursing, radiology, pharmacy, labs. They also have other areas of business like health plans. So this is a typical functional area design. Geisinger out on the East Coast just completed their implementation. We were actually right in the middle of implementation with them when COVID hit. They paused the engagement. We thought, we weren't quite sure if we were going to continue or not. They were tied up in meetings constantly as soon as they were under lockdown. The project manager of the engagement came to us shortly after and said, we need to get this up as soon as possible. We're doing this offline right now until the forecast is up and running. Let's get it moving. And we did. And their structure is also a functional area design. And they also have additional businesses that were challenging for them to understand how to put a forecast structure together, but easily saw how the KPI structure will work for them and identifying those key statistics that are really going to drive those businesses. So areas like not only their health plan using member months, but also their School of Medicine and Nursing, the Research Institute and Foundation, and then their shared service company. There are a few components of the rolling forecast product that are really critical in utilizing it to really take you to an advanced level of forecasting. The first and foremost are the forecast methodologies. Our rolling forecast product provides not only embedded calculation methods that help you forecast out more easily and quickly, but it also has trending methodologies like same quarter trending. So if you're a seasonal forecast group, you can select the same quarter option to really help you pull in that seasonality quarter over quarter. A last quarter methodology would take your current run rate of, if you're a growth area, and continue with that run rate with a last quarter forecast methodology. We also have annual average or a global driven type of forecast method. So plenty of options that are already embedded into the calculations to really make it more efficient for you to get into those workbooks quickly and easily, and then move on to reporting. One-time adjustments is a feature that has really been critical during COVID-19. In fact, I just had a discussion with one of our clients today about how they're going to use it to make sure that, having that COVID impact in the months of April, May, and June for them doesn't play into their future forecast as much as it would if we let it alone. So it really helps normalize your forecast, taking away a lot of that manual work trying to add back volumes and delete volumes and adjust growth volumes. So that one time a feature and utilizing that in the historical periods really helps so your forecast isn't distorted. And then finally, having the ability to have a volume-driven variability to really make your data actionable. There's a lot of areas in a forecast where you want it to be variable, flexing based off of your volumes. And so areas like salaries, operating revenue, and supply expenses, items like that, you really want to be able to have those costs and revenues shift as your volumes are shifting. I talked a little bit about how we helped our clients get on a rolling forecast model very quickly during the months of April through June. And that was really what we called a finance deployment model. We still see this now, and we did have this previously for those clients that really just wanted to slowly work their way into a rolling forecast process with their organization where they were testing it in finance. We call it a finance deployment model, and this really allows the organization to keep it all in finance first. Our cloud-hosted clients are typically the ones that are doing this phased-in approach. It's typically a 4 to 6 week implementation process where our primary users are the finance group. They have the option of using the machine learning from comparative analytics to really help come up with their functional area structure, or if they decide to use entity, it's pretty much already set up for them there. We have the starter kit for the forecast codes where we have recommendations on the calculation methods for different areas like supplies and revenues and other expenses. And it really helps get that first forecast up and running, taking that Excel spreadsheet that we saw many of our clients utilizing in Excel by an entity level, taking that out of play, using the software that they already had, and getting a forecast up and running that could be managed within finance. The other challenge is really just having the capacity for folks to be able to work on the forecast, and many in the business side did not have the capacity to help out finance forecast out. So this really worked well for many of our clients. Then when the organization started seeing that they had more capacity to get involved in the forecast, it's really that phase 2 approach where clients could then take 8 to 12 weeks of really taking them to the next level of forecasting, extending it beyond just the finance organization, bringing in that integrative support of other products within the Axiom suite, so having that integration with their long-range plan, utilizing a much more detailed deduction modeling where you can do deductions by payer for both inpatient and outpatient, taking the salary level down to more detail for job class level of detail, really heavily more utilizing that scenario and initiative modeling, and really just refining their forecasting capabilities, refining their group structures. Maybe they took it down a level if they were at entity in phase 1. Now they're ready to go to phase 2 and move to a functional area, add on allocations and eliminations so they can get a total company all-in reporting. And then really looking at their drivers that are impacting those key statistics in the forecast plan files, and utilizing maybe a demand modeling from Kaufman Hall to help them really do better at their driver metrics. So now let's talk a little bit about forecasting through COVID-19 and some of the challenges and recommendations. So immediately after the shutdown in early March, many organizations had to redirect their staff to different areas of responsibility just to keep the doors open, training non-clinical workers to do testing and screening at their doors. Additionally, facilities outside of the hospitals were being repurposed to continue services to ease patients' concerns from entering a hospital setting. The redeployment of FTEs and the additional COVID-19 related expenses became increasingly difficult to track for future FEMA reimbursement. So utilizing the initiatives feature in rolling forecasts that was typically used to layer in corporate directives like a cost savings initiative program or a physician practice acquisition or maybe a capital project expansion, that functionality was quickly repurposed to assist our clients with identifying trends for additional costs that were related to COVID-19. In addition to initiatives, scenario modeling soon became a solution to identify what-if scenarios related to recovery planning. We utilized scenarios previous to COVID-19, but that was more for a sniff test maybe to their long-range financial plan. But we are definitely seeing it more utilized now. So here you can see that there are 4 different scenarios that we've recommended to our clients to model during the scenario recovery and utilizing this functionality in the software. The feature allows you to adjust your global drivers at the facility level, and that will push down those volume trends like patient days, admissions or discharges, and visits to the forecast different recovery patterns. So as you can see here, scenario 1 is what we call the optimistic scenario. It assumes a quicker recovery, peaking in the early summer and declining moderately in the fall. Scenario 2 is the pessimistic scenario, and that assumes a surge of cases through 2021 and then slowing the following summer when a vaccine becomes available. Scenario 3 is our second wave, and this is after the first spring peak, and then a smaller peak in the fall, followed by a steady decline. And finally, a seasonal scenario, and this typically follows the typical flu pattern. Okay. So what we saw these past 4 months and continue to see is that rolling forecast allows health systems the ability to easily navigate the changing environment because frontline managers needed to focus on patient care. It enabled finance departments to provide a more rapid response to shift the system's resources where they were needed most. With the use of scenario modeling and initiatives tracking, they could pre-plan for different recovery patterns and easily forecast the impact of future costs for government reimbursements. Finally, it moved the conversation from a dollar and percent variance to a much needed per unit KPI metric to remove volumes from the variance conversation and focus solely on efficiencies and rates. Let's talk a little bit now about rolling forecast reporting. So I want to preface this slide with when we were in the middle of our implementation with Geisinger, again, a client that was replacing their budget process, there was still some concern around reporting and what will the department managers be utilizing. So you really have 3 levels of reporting needed, especially for a client that is replacing their budget process. So you can see these 3 levels of reporting here on the screen. So when you see the department manager section on the left, this is really for those department managers that no longer have a budget now. And so really the focus for them is on improving their KPIs over their previous historical performance. So the metric would be themselves. How are they performing against their own past performance behavior? We have a month-end dashboard that allows you to select not only budget if you maintained a budget, but also have you select the ability to compare to a 3-month average or your last year performance. We also utilize a drill to detail functionality. So those department managers, once they're seeing their variances to themselves, can drill all the way down to an invoice and then provide explanations on those variances utilizing the variance comments collection feature. And then providing an action plan. What are they going to do about their performance to really get themselves back on track? That variance comments collection functionality is really imperative for the forecast group owners who these department managers information rolls up to. Also critical for those department managers to really understand their FTE reporting and how they're comparing to a 3-month average. So there is some focus on the actual FTEs and the salaries and hours per unit and average rate per FTE. From there, that information that the department managers are explaining and coming up with their action plans, that information is then captured for those forecast group owners so that they know how are they going to forecast forward. The forecast group owners, the ones that have the actual workbooks that they're responsible for, so the surgery forecast group, the nursing forecast group, what are they going to be utilizing as a KPI for their trending and variance analysis. And so at a forecast group owner level, it's really the focus is on either a target or a benchmark. Some clients that really didn't have a focus on KPIs previously to moving into a rolling forecast decided to start with something simple like operating expense per unit, or perform at least how you were performing pre-COVID at an operating expense per unit and try to focus on that being your benchmark. Also critical for the forecast group owners is to use a dashboard too that tells them how is the group doing as a whole, utilizing their metric, whatever that key statistic is that's driving their forecast group. What is that denominator, and how is that trend of cost and revenue per unit moving forward? Are they going in a favorable direction or an unfavorable direction? And so looking at certain ratios and target variance reporting from those KPIs is really critical. Again, there is focus on FTE reporting, comparing their targets of actuals versus actual FTEs versus their forecasted. Also a focus again on salaries and hours per unit. This forecast group owner, they've got to coordinate within their department managers, getting that information from them, and then building out their forecasts and really understanding as a whole how are they trending forward. And then you've got the entity level reporting, and this is really that entity level finance lead who's really responsible for reporting at the facility level. So the focus at that highest entity level is really still on those corporate directives, because let's face it, the bottom line is still going to be a point of focus. So whether it's EBITDA, operating income, contribution margin, you're going to have that focus at that highest entity level. But also with that, having an overall key performance indicator, looking at your historical performance as a facility as well as your forecast targets. At that highest level, you could still have a KPI, operating expense per unit KPI, and that denominator might be something like CMI adjusted admissions or adjusted patient days. So there's still that KPI trending that you're going to want to focus on, but again, you'll also be looking at the bottom line. So really understanding your forecast performance as you roll up all of your groups together, and how will this now at an entity level crosswalk to your long-range financial plan is really critical. One of the things I talk to our clients about as they're working through the rolling forecast is really making sure that while rolling forecast reporting is really a forward-looking reporting process, there is a tool within the system and a reporting tool that also helps them reflect on their forecasting capabilities, because it's really important that you are getting better at this every time you do a forecast. You want to improve from this. It really comes from a lean accounting process, the rolling forecast process. And so a waterfall type report is going to help you determine, are you doing better every time you forecast? So as you look at this report, I want your eyes to focus on the first top row, the month of July. And this is a report that a monthly forecast client might use, and this is EBITDA. And so when they forecasted in July, and then you look at where did they think they were going to land in February, when they did their July forecast, they landed at $78,014,000. And every month as they do their forecast, you can see where is February's EBITDA going to land, until they finally get to February and their actuals hit. And so the goal here is to look at your actuals in February and understand at what point was I veering off course, or where was I close to my actuals? And what did I do differently after that that then steered me in the wrong direction? Was I too aggressive in my forecasting methodologies? Was I too variable in my expense areas? Do I need to adjust my statistics for my group? Maybe it's not the right statistic for the area. So really reflecting on what you did previously to help you get better at it the next time you go to bat to do your forecast. So really important to understand how are you performing, and really our first client in Axiom, Common Spirit, really was great at this because they really took a quality of earnings type approach where they wanted to really understand, the over-under projections and identify trends where some forecast managers were being too aggressive and some forecast managers weren't being aggressive enough, and really reflecting on how they were doing in forecasting and making adjustments at the finance level to accommodate to those different types of projections from those groups. Pre-COVID, I can tell you not many focused on the balance sheet in a rolling forecast environment. Many that had budget as part of their suite or the long-range financial plan utilize the balance sheet and cash flow from that perspective on an annual basis. Well, that definitely changed with COVID-19. Definite reforecasting of their liquidity position with poor market performance on their investment portfolio. There was a lot of focus on their liquidity. They had the reduced points of service collections that they were struggling with, their accounts receivable collection area, slower claims processing, increasing government receivables, increasing bad debt from commercial payments. I mean, the balance sheet was all of a sudden a very important part of the forecasting process that our clients did not want to wait to do it once a year. They wanted to forecast quarterly. So, I always say you can't forget about the balance sheet. It's just as important as the income statement. So really keeping that focus also on the balance sheet and having that forecasting capability is critical. All right, so I have some final thoughts, and I know we got through a lot of material already, but we've got a good amount of time still for questions. So my final thoughts on what have others done to succeed in rolling forecast. What I've seen first and foremost is really, going back to those two questions, defining what is the purpose that rolling forecast is going to play within your organization. Once you know that, will it complement or replace that annual budget process? That's really critical. Executive sponsorship is critical. You can't have a senior leader asking for a report that look like the budget report if they've replaced budget with rolling forecast. Your reports are going to they're going to look different, and there's going to be different information. So you're going to need to find better ways to report information than you have in the past. And I always say, work on better work, not busy work. So really identify those critical reports that you're gonna need to be successful in a rolling forecast. And having those conversations, start shifting now, whether you move to rolling forecast now or long term. If you're not talking a per unit conversation within your organization, start now. And focus on incremental improvements from those KPIs. Also identifying who are going to be the folks that are going to work on the forecasting process. Are you going to keep it in finance? Are you going to push it down a level, maybe to directors or VPs in your organization? Who are those planning contributors? Because their work is going to change. And so really wanting to make sure that you've got the right people forecasting in your organization. Also setting clear reporting expectations like we talked about, and what is that feedback loop? So if you don't have a reporting capability to require comments and feedback, have that accountability in reporting, the forecasting is not going to be successful if you're not holding people accountable to the forecast and expecting them to improve. We've had some clients that when they first moved into rolling forecast, they kept it simple and the targets were do better than prior performance. And the ones that didn't had to speak to finance every month. And so the goal and motivation for them was to do better because nobody wants to talk to finance. So you can find creative ways to keep your organization engaged and held accountable Keep it simple. So start your journey with keeping it simple to start. Walk before you run. And then finally, working on the continuous improvement mindset related to your forecasting capabilities. Again, rolling forecast stems from a lean accounting approach. So the goal is to improve and really be efficient with the process. And before we go to Q&A, I'd just like to show you a few of our rolling forecast clients. On the left are the clients that we've had rolling forecast clients for a number of years. It's just a sample of our clients. And on the right were some of the clients that we engaged us once COVID hit, and we're getting them up and running right now on rolling forecast. So it's been a great journey with them, and we really look forward to continuing to work with them. So I do see we have a hand raised. All right. I'm going to stop sharing. Do we have any questions? Hey, Tammy, I can't hear you. Are you going to see Mike Smith raised his hand?
Let's see, is there any questions for Angela? No questions.
I see Mike Smith. I'm going to allow him to.
You see some of them?
Yeah, Mike.
Hi, thank you.
Hi.
Thanks for the presentation. I've been trying to type, but it's like getting the words to the typewriter or the keyboard is a different thing. Anyway, thank you very much for the presentation. I actually worked with your program at another institution about 4 or 5 years ago. Quite impressed with it. The question I had was, I worked with it for about a year, and so I kind of got four cycles of it, 4 or 5 cycles of it, but not full education. And I was one of the set of the departments. I managed the revenue cycle.
Okay.
Versus the accounting side.
Okay.
There was a bit of an orientation to get into it, but then I felt that once you got into the process, it felt pretty good. Mm-hmm. I question whether or not it really cuts down the time that you spend in budgeting. It actually may be, my question is it really a little more just spread out throughout the year? Or is there, from maybe the non-accounting people, from the departments, it's not so much of a major rush at budgeting?
Yes, that's a great question. And I think it's a little bit of both. And I think as you continue to use it, you refine it to find areas where you can gain efficiencies. So what I mean by that is, I have a client that's already been forecasting for a number of years and realizing that there's a relationship with the drivers and statistics that if they were better at identifying that relationship, it might mean less time that they're spending trying to figure out, pulling out of thin air what their drivers are going to be to then impact, what are the patient days going to be 6 quarters from now. But if they do more demand modeling and really understanding that relationship and then pulling together the right grouping for that forecast, that there's less of that type of work. Some clients are pulling a lot of that work within the finance area to take it out of the hands of the end users. So more so from an end user perspective, there's less time from them, overall. But then finance, I think more so it's just a shift in responsibility, like you said. So it really, I think you're going to see a little bit of both. Like I said, I think maybe in finance you might not see a big savings overall in the short term. Mm-hmm. Long term, as you work with it, you will. From an end user perspective, you're not going to have it down to a department level, right? You don't do a forecast down to a department. So your department managers aren't really focusing on a budget that they're preparing anymore. Their forecast group managers are working on a forecast.
Yeah.
But the department managers, where their work is going to be is providing that variance information, letting the forecast group managers know what's happening so that the forecast managers can do a better forecast. Yeah. So that there's going to be a shift in the type of work that everyone's doing, right? Yeah. And again, it's going to be better work, not busy work.
I actually felt good about it once you started to get the hang of it a little bit. And it was, it's definitely, it's kind of like putting on your left shoe on your right foot to begin with. It doesn't feel right. It feels odd, but yet it's got a sense of rhythm and purpose. And so that's what really drove it.
Yeah, culture plays a big part in success. And so, some organizations where, maybe the senior leadership is ready, but their organization is very much tied to the detail, and knowing that their organization might take longer to change in a process, that plays a big part. But education and helping them move towards this in maybe a slower incremental phased approach is what helps them get to that process. By no means are we ever saying that you should replace budget with rolling forecast in all cases. Rolling forecast works very well with budgeting. I would recommend you don't do a forecast at a functional area level if you do maintain a budget, because that's too much detail, and you can get a lot of that from your budget process. I would roll up forecasting to a higher entity level and have that give you a better look at what your long-range plan is going to look like at that higher facility level. Keep that nimble. So it's just a different shift of workflow and responsibility. So
thank you.
No problem.
I think we have a couple questions here. What's the different accounting systems that you have integrated with?
We are already, a lot of our clients that are already existing budget clients are already integrated with many ledger systems. We have Lawson, PeopleSoft, pretty much any GL system. But the rolling forecast product, in most cases, our clients are adding that once they already have the ledger data already interfaced in the system. But we interface with any GL system you have. So. And it is a GL-based structure. Like I said, with payroll, you have the option of pulling in your payroll level detail if you really want to have a little more level of detail. But for the most part, it's based off of your GL structure.
And then another question is, how similar is the setup to a rolling average for bad debt allowances?
I'm not really sure I'm understanding that question completely. We do forecast our deduction modeling by payer and bad debt and charity. Are you specifically asking about net revenue forecasting?
This is a question in the chat. It just says, how similar is the setup to a rolling average for the bad debt allowances?
Yeah.
Harold, would you like to expand on that?
Yeah.
We'll see if Harold responds to that.
Okay. I mean, we have a rolling forecast for both income statement and balance sheet. So, and it's done quarterly. We also have a monthly forecasting model. So hopefully that answers your question.
It's another moving average model, is what he says.
Okay. Yeah. I mean, this is not just a moving average. It could be the historical trend, a growth rate trend that you had from 4 quarters ago. It's not always embedding just an average. So definitely, another way of forecasting on a quarterly basis, using your historical data, and then layering on top of that some more complex calculation methods that include key statistics and drivers and different forecast trends to help you achieve along, out to 3-year quarterly forecast.
Hopefully, Harold, that answers your question. Any other questions for Angela? Well, thank you, Angela. Great presentation. We really appreciate you joining the Oregon, Washington, Alaska chapter.
Thank you. It's great being able to talk to you all today.
And for those of you who have taken this session, in the chat link is the link for the survey. Please click the survey and take the session. It's always great to know everybody's feedback so that we can continue to provide you the online education. Next session is at 4 o'clock with the patient accounts problem solving. It is a separate link, and so we will see you then.